Today we're going to talk about a bacteria called methicillin-resistant Staphylococcus aureus.
What is it? Better known as MRSA is a potentially dangerous type of staph bacteria that is resistant to certain antibiotics and may cause skin and other infections. MRSA is a bacteria commonly found on the skin and nasal passages of many people. It is a strain of Staphylococcus aureus which is resistant to most antibiotics, which is why it is such a difficult infection to treat. The infection occurs when the bacteria passes the surface of the skin into an open wound site.
Where does it come from? Anyone can get MRSA through direct contact with an infected wound or by sharing personal items such as towels or razors that have touched infected skin. MRSA infection risk can be increased when a person is in a certain activity or place that involves crowding, skin-to-skin contact, and shared equipment or supplies. This might include athletes, daycare and school students, military personnel, and barracks, and people who recently received inpatient medical care.
Symptoms. MRSA first appears as a bump or infected area of skin. Many mistake it as a spider bite, an ingrown hair, or simply a pimple. Symptoms of MRSA include bumps that are red, swollen, painful to touch, warm to the touch, or bumps that are filled with pus or fluid. If you have a mysterious bump and it is accompanied by a fever, this could also be a sign that you have contracted the staph infection, MRSA.
Treatment. In some cases, an antibiotic can be prescribed for MRSA. These antibiotics include clindamycin, doxycycline, and minocycline. Medical professionals can also drain the infected area. In serious cases, surgery may be required.
Prevention. Some methods of prevention to help you from contracting the MRSA virus are as followed. Cover your infection. Pus from an infected area can contain regular staph or MRSA, so keeping it covered will help prevent spreading the infection to others. Follow your healthcare professional's instructions about proper care of the infection. Be sure to discard bandages in the trash. Another method would be to clean your hands. You and your family should clean your hands frequently with soap and water or an alcohol-based hand rub, especially after changing the bandage or touching the infected area. One last prevention method is to not share personal items. Avoid sharing personal items such as towels, washcloths, scissors, razors, or clothing that may have had contact with the infected area or bandage. Wash soiled sheets, towels, and clothes with water and laundry detergent. Use a clothes dryer or dry clothes completely before using again.